Caribbean Vulnerable Communities Coalition is calling for changes to allow minors to access sexual and reproductive health services without parental consent. On Zoom to discuss this is Kobe Smith. He's the co-chair of the Caribbean Vulnerable Communities Coalition. Welcome, Kobe. How are you?
Good morning, and thank you for having me.
Okay, this is a very controversial issue, and let us start off by talking about the fact that when you talk about lowering the age of civil responsibility for health decisions, what exactly does that mean?
Wonderful question. It basically means that we give young people the legal right to consent to their own health care, like HIV testing, contraception, sexual and reproductive health services, without requiring or needing parental consent. In practice, it's about removing the legal barriers so adolescents can access life-saving health care, confidentially and without delay. I would also want to say, just on the side, that we also need to consider that Jamaica signed on to the Convention on the Rights of the Child, and within that convention, Jamaica would have ratified the right to health for children. And so it basically means that young people should have access to critical services that will protect their health and well-being.
When you say young people, can you clarify?
So we would include in that group adolescents, but generally persons below the age of 18 years. That's how we define young people. Well, in this context, in terms of persons who are not adults, which would be persons below the age of 18, that in this context.
But there is a thought, though, that persons under 18 are considered children and should not be engaged in sexual practices. What are your thoughts on that?
So I think oftentimes we conflate the issue to suggest that whenever we are advocating for young people to have health information and education, that somehow we're encouraging them to have sex. That is not what advocates or CBC or any of our regional partners are actually advocating for. What we are advocating for is for young people to have access to safe, rights-based, culturally sensitive information that will protect their health and well-being. What we also know is that the Caribbean has one of the highest rates of adolescent pregnancy. We also know, coming out of the UNAIDS, that there has been an increase in HIV cases within the Caribbean. And so that is a challenging situation. And it therefore means that we have to look at the situation where young people are not being able to access information and they're not being able to access services that will protect them from those sexual risks and other particular needs to protect their health and well-being.
The Jamaica Children's Advocate is arguing, or has already argued, that young people, certainly in Jamaica, can already consent to some medical treatments at 16. Why isn't that enough in your view?
Because, respectfully, sexual activity, risks, and health needs don't wait until 16 years. Many adolescents begin experiencing these realities earlier. And if, in fact, we delay the access to services, it actually puts them at great risk. By the time they're legally allowed to consent at 16, some of these persons would have experienced or contracted HIV or other sexually transmitted infections, or they would have also fallen into the pitfalls of unplanned pregnancies, which in fact is a challenge, and there's a ripple effect of dropping out of school and the other social ills that we can talk a lot about here this morning. And so really and truly, the law needs to reflect the lived reality of young people's lives and their well-being.
Mm-hmm. What kind of support are you getting from the authorities about this proposal of yours or the association to change this law?
So the support for young people's or adolescents' access to health services to protect their sexual and reproductive health is actually one that is supported by the Family Planning Associations in the Caribbean. It is supported by the United Nations and other international agencies, and is actually supported by research and evidence. I would refer our listeners to also cite the UNAIDS most recent report, which shows that there has been an increase in HIV cases, or the newest cases of HIV are actually higher in the youth demographic. And it also means that we have to do more, not just in terms of ensuring that young people can access these services without parents or without their consent. Because let's be honest, not all parents are comfortable, number one, talking about the issues relating to contraception or even believe in contraception. We live in, well, in some countries and in some communities, in some very conservative families. And so if, for example, a young person would like to access contraceptives to prevent pregnancy, who's to say that their father or mother does not support that? And so it basically means that we're opening, the floodgates for more adolescent pregnancy. It means that we're opening the floodgates for more HIV cases and STIs. And then when in fact a young person becomes pregnant, because we don't allow them to access contraceptives, we also don't want them to access abortion care. And so I think respectfully, we all need to come to this conversation in a very objective way to really say what is in the best interest of children. The CRC, the Convention on the Rights of the Child, actually talks about the best interests of the child principle, which says we need to put what those issues are at the top of the list: healthcare, well-being, rights. And we will continue to push for these particular reforms because it's really about what is in the best interest of children, and healthcare is in the best interest of children.
And how do you respond to suggestions that your advocacy should be limited to abstinence as opposed to promoting access among youth in the Caribbean?
That's a wonderful question. And I think we need to look at the statistics and the context. So we've been talking about the abstinence-only approach for at least 3 decades. And we need to ask, what are the results of the abstinence-only approach? When we say to young people or adolescents or minors, don't have sex, but we know, based on reality, that they are having sex. We're not promoting, the reality for young people to have sex. What we're seeing is they are young people who are having sex, and it therefore means that we need to put the safeguards, give them the tools to be able to protect themselves. So if in fact they do have sex, they have access to condoms, they have access to IUDs, implants to, of course, prevent pregnancy, and they can also be tested and treated if in fact they test positive for an STI. And so research shows that the abstinence-only approach is not effective. And so it basically means that we have to ensure that there's the education. That's why we also advocate for comprehensive sexuality education in and out of school, for persons to have those tools to protect themselves, and also to have an honest conversation to say that when we promote sex education, we're not promoting or encouraging young people to have sex. We're basically saying, protect yourself, ensure that you live along and lead healthy lives, which would mean that you need to access these critical health services.
Co-chair of the Caribbean Vulnerable Communities Coalition, Kobe Smith, thank you so much for joining us here on Smile Jamaica this morning.
Thank you so much.
Thank you so much. Now, the second edition of News in 5 is up next. Please stay with us.